Hi, how are you? Not feeling too good? Okay, let me go ahead and take down your symptoms on my computer here. Okay, so could you just tell me what you've been feeling? Could you just tell me really quick what kind of symptoms you've been now could you tell me what kind of symptoms you've been having? Okay. Just not feeling well. All right. How long have you been not feeling well? Okay. Have you been drinking enough water? Okay. How's your taste been? Have you lost your taste at all? Okay. Smell. How's your hearing? Can you hear that? Okay. Any issues with sight? Can you see my fingers? How about now? Perfect. All right. I think we should just do a full body examination just to make sure that all your cranials are intact, ears, nose, and throat. We'll definitely check the abdomen area. I'm going to go ahead and put my gloves on. Okay. If you could just go ahead and tell me what you had to eat today. Okay. Can you tell me what time of day it is? And what color is my shirt? Good. I'm going to go ahead and start off with having a feel of your neck and your lymph nodes and your face. Okay. Checking the lymph nodes on the clavicle, lymph nodes by the neck. Okay. Just having a feel of face. Any pain there? Okay, I'm just going to tap on your face. You feel any pain there? All right. Feel of the chest area. I'm going to feel of the abdomen here. Any pain while I palpate? And the hip area. Okay, let me go ahead and have a feel of your abdomen. Just want to make sure there's no lumps or bumps to begin with. Have you been having any shooting pains, any sharp pains, anything like that? Okay, does this hurt at all? Okay, I'll have you take a deep breath in for me. Good. Very good. I'm going to listen for some bowel sounds with my stethoscope here. Go ahead and use my stethoscope and listen for some bowel sounds. Okay, so I'm just going to have you breathe normal. Take a deep breath in. Good. Very good. I'm hearing normal gurgling sounds. So what I'm going to do next is I'm actually just going to have a feel of your liver and your spleen. So I'm just going to press on your belly just a little. Very good. And I'll have you breathe in. Okay, no liver enlargement. Very good. Okay. Perfect. I'm gonna go ahead and have a look of the coloration of your arms and your hands here. Okay, coloring is good. No clamminess. Let me go ahead and check the other side. Okay, no clammy hands. Coloration is normal from arm to fingertips. Okay, I'm gonna go ahead and have a feel of your legs. All right, I just want you to tell me if you feel any tingliness, any numbness. I'm just gonna stand up for this. All right, any tingling sensation or numbness as I have a feel of the legs here. Okay, just going further down towards the knee. Any pain on the knee here? All right, I'm just going to check the bottom of the leg, sort of by the, oh, what is it called? And I'm just having a check of the calf here on the right side, and then moving down. Any pain? Okay, any tingliness? Any sensations I should be aware of? All right, just having a feel of the foot. Okay, I'm gonna come back and have a feel of the other side. No tingliness or anything. Just having a feel of the foot here. Okay. Can you push on my arm with your feet? Good. All right, perfect. I'm gonna go ahead and do a really quick palpation on your chest. Any pain? Okay. All right. Let me go ahead and have a listen of your heart. I'll be looking for a strong heartbeat. So I'll just be lifting the blanket again. All right. Breathe normal. Okay. Have a listen of the lungs. I'll have you take a deep breath in and relax. Perfect. And the other side. One more time. Breathe in and relax. This is very good. I'm going to keep my stethoscope here, and I'm actually going to be checking your blood pressure. Have you ever had your blood pressure taken before? Okay. What I'll do is I'll be popping this on your arm. So let me just go ahead and find your arm underneath all these blankets here. Okay, there we go. Just gonna lift that up. Sliding it on your arm. Just see if we can go ahead and slide that on. Perfect. This over here. I'm just going to put this right over here. Okay. Stethoscope on. This will go just on your arm right here. All right. Just checking this. breathe normal for me if you can. Good. All right, your blood pressure is 170. Okay, and your blood pressure is 118 over 70, which is normal. Let me go ahead and take off the cuff, okay? So I'll just be sliding it right off. Good. So now we're going to go ahead and check your temperature next. So just hold still. Good, 98.1. Now I'm also going to check your oxygen. I'm going to be putting this on your index finger for about 3 seconds here. Just checking the oxygen. Very good. Okay. All right, so now what we're going to do is I'm actually going to have a look into your eyes. I'll be using my light, and I'm just going to be pulling your eyelid down. And so I'm just going to come up a little bit close. So I'll just be pulling down the eyelid. Can you look up for me? Good. Look to the right and the left. Good. Look at my fingers. Okay. I'll be checking the other side. Just be checking this side. Can you look up for me? Good. Look to your left. To your right. Good. I'm going to have you follow this light, okay? Follow it right here. Okay. Now what I'll have you do is tell me which fingers are moving. So I'll have you look at my nose and tell me which fingers are moving. Okay. Tell me when you do not see my thing, and tell me when you do not see my fingers anymore. And go ahead and tell me when you do not see my fingers anymore. Now I'm going to use my ophthalmoscope to take a look inside of your eyes. I'll be looking at your optic nerve, and I'll be coming in quite close. Okay, so I'm just having a look at the optic nerve, and I am seeing that there's normal vein distribution, and I'm not seeing any tears, no dry eyes. Okay, checking the other side. Okay, so this eye looks really good as well. Doesn't look like you have any dry eyes or anything like that. Normal eyelash distribution. Okay, your eyes look awesome. So what I'm going to do now is actually check your color vision test. I have a few different shades of paper here, and I just want you to tell me what color they are. Alright, so we'll start off with the first color. Would you say that this color matches my shirt? Yeah, okay. And what color is this? Good. And this? Great. This color here? And this. Okay. Ooh, there's two colors. Orange and purple. Good. I have a Snellen chart here, and I'll have you tell me what letters I'm pointing to. Okay, so I'll just have you tell me what letter is this. Okay, how about this? And this. and this, and that, and this. Can you read this line here? Okay, and can you read this line here? And what color is this? What color is this? And which circle is the biggest? Point to the biggest circle. Oh, your eyesight is very good. I'm very impressed. I'm gonna go ahead and take a look inside your mouth now. Have you had any dry mouth or taste issues? Okay, go ahead and say ah. Go ahead and say ah. Teeth are done. Your teeth look really good. They look really clean and white. No signs of gum disease. Can you go ahead and stick out your tongue? Okay, wiggle it around. Okay, I want you to go ahead and puff out your cheeks and don't let me close them. Okay, very good. I'm gonna have you open your mouth. Okay, I'm just gonna tap. Very good. Okay, can you smile? Let's go ahead and do a taste test now, just to make sure that your taste buds are working properly. And what does that taste like to you? Very good. Let's try one more. Let's try one more. Let's try this. Just tell you what this tastes like. Yes. Okay, very good. How has your smell been lately? Pretty good, you would say? Let me go ahead and have a look inside your nose. I'm just going to look for a deviated septum or redness or scabbing or anything like that. So I'm just going to be coming close for this one more time. Okay, so the nose looks really good. There's no deviated septum, no scabbing, no redness. Good, let me check the other side. Okay, so it looks really good. I'm not seeing any redness. And no discharge, normal distribution. All right. Let's go ahead and have you actually do a smell test. I just want to make sure that your senses are in order. So I'm going to have you go ahead and tell me what this smells like. Very good. Let's go ahead and do one more. Okay. I'll have you tell me what this smells like. Yes. Nail polish. I actually love the smell of nail polish. It's like the best. Now what I'm going to do is I'm going to have a feel of your ears, okay? And I'm going to just pull them back a little bit, you know, like that. Okay, I want you to just tell me, did that hurt at all? Okay, how about this? And this? I'm going to go ahead and look inside the ear, okay? So I'm just going to go ahead and pull the ear back. Just a little bit of wax, not much. Nothing to be concerned about. I'll just be pulling your ear up. No redness, no swelling. Tympanic membrane is pearl gray. Let's go ahead and have a look in this ear. Oh wow, okay, looks really good. Just a little bit of earwax, not too much. I'm not concerned. Tympanic membrane is pearl gray again. And there's no excess redness or anything like that. Nope. Very good. So I'm not worried about your ears on the inside, but let's go ahead and do a really quick hearing test. I'm going to go ahead and have you close your eyes, okay? And I'll have you tell me when, and I'm gonna go ahead and have you close your eyes and tell me which ear you hear this. And which ear do you hear this? And this ear? And again? I'll have you tell me now if you hear the sound going further away from you or coming closer to you, okay? All right, very good. How about now? Yes, no. Yes, very good. Now, I'm going to have you tell me what ear you hear this sound. And how about now? And now? And how about now? Very good. And what did it sound like to you? Scissors. Very good. I'm going to have you tell me how many times you hear this. Go ahead and count and tell me how many times you hear it. Okay. Very good. 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 Yes, very good. Now I want you to guess what this sound is. So I'll have you close your eyes. What does this sound like to you? Okay. You're correct. It is a spray bottle. Yes. Very good. Now what I want to do is I want to whisper something into your ears and I want you to just repeat it back to me. Does that sound good? Okay. ASMR. Okay. ASMR. ASMR. Beautiful. Pink. Purple. Sorry about that. We also have a vet in this hospital and unfortunately the dog is barking a little bit. Hopefully that's not a bother to you. Alright, everything is looking good so far. We're going to go ahead and do a sharp or dull test, okay? So this will be dull and this would be sharp. And I just want you to tell me which one's sharp or dull and I'll have you close your eyes for this. Good. Good. I'm going to go ahead and do the same test on your chest and abdomen. I'm going to go ahead and do the same test on the chest and abdomen area, but I'll be using this side for the sharp, okay? Good. All right. And I'm going to have you tell me, just say yes when you feel this on your face. Very good. All right. Now we're going to do a sensation test on the face that's either warm or cold. So I want you to tell me if this feels warm or cold on your face. And how about this? And how about this? Okay, just say yes now when you feel it, okay? Good. Good. Very good. I'm now going to go ahead and check your reflexes. And so I'll have you just relax while I check your arms. Okay. Your knee here. Your other knee. And your hips. Let me do the Babinski test on your feet here. Okay, so this sharp object, if you can see it, I'm just going to put that underneath your feet. I'm looking for your feet to curl. Good. Very good. Can you feel this? And how about this? And how about this? Okay. Do your feet hurt at all? Any pain at all? I'm going to go ahead and have a look of your feet. I want to make sure there's no gout or discoloration. Okay, so I'm just going to be having a look of the feet and a feel of the feet. toe coloration is normal. You have no swollen feet, no swollen ankles. Does that hurt at all? Okay, do you feel any pain when I do this? Okay, let's have a feel of the legs here. Any pain? Okay, any pain here? All right, how about here? Okay, I'm gonna look at your legs. No signs of gout. No bruising of any kind. Let me go ahead and check the other leg here. Okay, no bruising. Okay, no bruising. No signs of gout. Nothing swollen. All right. Next, I'm going to go ahead and have a feel of the groin area. Looking for enlarged lymph nodes. Do you feel any pain? Okay, that's a good sign. All right. I'm gonna put my arms behind your back and have a feel. Any pain? Okay. How about your rib cage area? Do you feel any tenderness there? Have you been working out at all? Sometimes these areas can become tender when you've been working out a lot. I know for me, when I do like arm workouts in the gym, I get really sore here. I'm just having a feel of underneath your armpits. Trying to feel the lymph nodes there. Also having a feel of the lymph nodes on your chest. Underneath the chest. Okay, and I'm having a feel of the arms here. I'm just checking to see if there's any lumps or anything like that. Okay. And can you feel that? Okay, very good. But no pain though, right? Awesome. I'm going to go ahead and do a full body measurement. We'll start off with the chest. $18 across. Chest to the abdomen, 19. Chest to the abdomen, 19. Go ahead and go across the lower chest area, 17. The abdomen, 18. The hips are 16 inches long. Go ahead and do the hips all the way down to toes. Looking at 43 inches. We'll do the other side. Looking at 45 inches. Interesting. Okay. Do the lower leg to the ankles, 33. Go ahead and do the lower leg down to the ankle, just 33. I'm gonna go ahead and measure the feet. 10 inches and 10 inches. Come back here and go ahead and measure the arms. The ends of the index finger, just 34. 34 as well. Your measurements are very even. I'm not worried about anything. There's no lumps or bumps or anything that I'm concerned with, but I am going to go ahead and have one last feel of just the chest area and the abdomen area. Okay, so we're just gonna have one last little feel. Just double checking the lymph nodes. Okay, very good. Okay, very good. And the abdomen is feeling really, really good for sure. Now what I'm gonna do is I want you to tell me, I'm gonna do a little bit of acupressure. It's not much, but I just want you to tell me when you feel it, okay? So just say yes when you feel it. Good. 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 Alright, thank you for doing that. You did a great job. So I'm just going to go ahead and notate everything we did today. Okay. Vitals were good. No lumps or anything in the abdomen area. Okay. Perfect. Well, thank you so much for coming today to your full body exam. I hope that you do feel better. As far as all of my concern with anything, I feel like you should be fine. I just think you should drink lots of water and get lots of rest, okay? All right, feel better. Have a good night.